dealing with a post-operative, cranky and unhappy patient, Dr. Meenu Mathin, sir. You've done everything right. Dr. Mehta initially only said, you've done everything right and that guy will be cribbing, and you've done something wrong in the OT and that guy will be very happy next day. But how do you deal with the first type of patient?
Just want to ask a general checkup. How many of you don't have cribbing patients?
So everybody will have this kind of.
So Mohan's answer, either you are a gynecologist or you don't operate.
No. The cranky patients are ones who have been got an excellent surgery done.
Anybody who doesn't have unhappy so anybody who doesn't have a post-operatively unhappy patient are not doing enough cataract surgery. So that is a different issue. Everybody will have. So one category of them, you will be able to identify them pre-operatively itself. That is why we need to spend some time, talk to these people and identify how they talk. They will come and tell you that lift operator did not let my attendant come inside. There I waited. One person last week told me, I waited for 20 minutes at the pharmacy and they did not give. You know that? So pre-operative itself, please assess these kind of patients who are going to be definitely unsatisfied with whatever, some kind of odd things they will tell, whatever reason. So please identify bystander, the attendant and the patient who are like this. So I have another patient whose daughter came from the US, did everything. We knew each other very well. Daughter left and she started having, she is a dry eye patient with the corneal catheter. So she keeps having this problem repeatedly. She keeps calling and telling that why did I do this kind of surgery? So cornea is so clear and vision is all fine. Only thing is because of her corneal edema, she is getting on and off mild blur. So we have to identify these people and we have to we have to be bold in some way, but then identify. If you tell against that you don't have a problem, then then they will not agree. Either they will keep coming and keep eating your head, or they will change surgeon and they will tell bad about you in some other place. So I think we have to accept identify what is their basic problem. There may be other problems at home also. That is another thing which we have to understand. There may be patients will have personal problems inside home, work problems, which they want to vent out somewhere here. So please listen. I do listen to all these, what they tell, and then make sure that everything else is done right and the eye is also fine. Then try to treat them psychologically, talk, and then show them picture of this thing and all those. And so finally give sometimes I give very costly medications. Some people are very happy with that, some Cystine Ultra or some 1,000 rupee drop, lubricant or something, and they get happy with that and all those. So this is very costly, this will work for me. Or sometimes some people are without any reason, I didn't have a problem, but then this guy is giving me costly medicine. So that also you have to take care of, be careful. People think of all these things. Why is he trying to give me medicines? So such kind of people, please identify. See, pathology and the problems which you have created, please identify, please try to solve them. But these kind of, can't call them cranky, but then once surgery is done, they feel that there's something which has happened there and something might go, so they will need some support from you. So that is what many of them will, okay, this will get okay, and sometimes see me after this many days, take this medication, do this. I tell sometimes very, very odd things which are not connected to the eye at all. I tell them to take, sometimes give antioxidant and ask them to take particular time after this particular meal, then only take that, and or use this kind of medication after you have done a particular thing. So turn their attention to something else and then ask them to focus on some other things so that they forget of these kind of things which they keep on thinking and want to tell you. So there are many other ways to deal with the type of city you are in, the type of patient you are facing is all different. The type of practice you are in, whether you are in a very bulk practice, whether you're in a city or in a private practice, type of patients are all different. So each one will have to take their own approach to that.
Dr. Sudeep, sir, it's easier for an experienced person, I think, to deal with such a situation. But as a youngster, Dr. Sudeep and then Dr. Pavitra, please.
Obviously, when I just started 2 years ago at my private setup, I had 50% of my practice is more or less premium cases. So, you have to know your numbers first. You have to know your post-op results first. You should maintain a logbook. That is something I still do. I maintain a logbook. You should know what your incisions will do to the patient post-op. Especially if you're doing anything IQ and beyond, you should have a good idea as to what the post-op results will be, especially before stepping into multifocals. You should not just come into a private setup and start doing multifocals from day one. Even if you've done them at a charitable setup, there is a huge wave of a difference between a private patient and a charitable patient and a free patient. So, I mean, that is one. Secondly, I mean, if your patient is not really happy, I mean, I think you should let the numbers do the talking again. I mean, show them the ARK reading. I mean, I think that's a gold standard. I mean, patient can't say much to that. Show them the macula OCT. There is no edema. There is no. Show them the centration of the IOL. And even in toric, sometimes the patient is not, he's not really convinced. You can again show a pre-op sheet where he had a 1.2, 1.5, whatever TK reading he had, and then what is the AR reading today. So I think these, I mean, I mean, your logbook should be maintained. I mean, from the beginning, I mean, you should be very, very religious about it. I mean, you cannot take shortcuts to greatness. I mean, I believe that, so I mean, your logbook should be maintained, and you should have a very good data. If you have a good EMR, your optometrist should know to put in every AR data on every visit and every post-op, so that's easier for you to kind of, introspect. You're sitting idle in your home on a Sunday also, you can just check your EMR, you can see your post-op results, you can compare, you can introspect. I mean, I think introspecting after every surgery is very, very important. How you could have been better. I mean, I think that is the golden rule of surgery. And so, I mean, these are the things, but yes, if a patient is unhappy, sometimes, yes, it's something is beyond even the numbers of the AR reading or your result, which you are very happy with, frankly. But then again, at the same time, I mean, sometimes you just have to be very patient. You just have to keep listening to them. Because, I mean, experienced surgeons, the seniors over here, I mean, we are blessed to be under their guidance. They have a certain, authority, which even sometimes the patient doesn't question, but to us, they might think that, oh, why did I come to you? I should have gone to that center? And, don't let that affect you. I mean, I think everyone has had those patients in their junior days when they were also told such things on their face. And I mean, counseling is everything in private practice. Private practice is all about counseling. I mean, there is no other secret to it.
Dr. Pavitra, numbers and only numbers or something else also?
See, for me, I won't be talking about a post-operative unhappy patient overall. See, I am into a private practice since past 18 months with a father-in-law who has a practice of or experience of 30 years. So for me, being a young doctor, along with that being a female doctor, is again the difficulty level just rises. So basically, dealing with a cranky and unhappy patient for me, increased chair time, it helps a lot. And apart from that, if at all, I mean, we have a lot of free samples at our clinic that our MRs and all give. So for me, sometimes if nothing works, I tend to give them a free sample, and sometimes it works. And if nothing works, obviously I have my father-in-law at my disposal, whom obviously he will deal with all those patients. But increased airtime and over talking sometimes help. And obviously, you have to be extra sweet to the patient when you are in a setup where you have other colleagues or a senior doctor with you sitting at the same clinic. So you have to be really sweet. And yeah, that is what helps.
Pavitra, I just wanted to ask you one thing. You said female. In what context was this particular word used? Because ophthalmology is being dominated by females, and it is always said a caring and a touching hand by a female is more effective than a caring and a touching hand of a male.
Correct,
so I personally feel when it comes to an unhappy patient, if you are not able to, what you need to give is a chair time. What Dr.
That works. Definitely.
Chair time. You need to distract him. You need to satisfy him by giving a tea or a coffee, by reducing the waiting time in the OPD, pharmacy, optical, everything. So this is, I'm talking about a perfect 6-6. Everything is normal, but he's unhappy. So you need to counsel. And if still he is not happy, you send to another colleague of yours, especially if you have a female colleague. She will do a very nice mentoring and counseling for that particular patient, and the patient will come back happily to you. Sir, आप तो बहुत बड़े डॉक्टर हो यार. That madam was telling you are so good and I don't have any problem. This is one category. Second category of unhappy patient is they are really unhappy because of the outcome what we are given to them. But now how to satisfy these people? You treat whatever possible complication has been there. You treat properly at what level you can do. If you are not able to manage anything, you refer the patient to a colleague of yours who is a master in that. I tell the patient, see, I have done a good job, but there needs a further super specialist opinion. He's a friend of mine. I'll refer him to you, and he will do a good job. Once the patient is referred there, you should have a good rapport with your senior colleagues or your specialist colleague. He will counsel the patient and treat it. The patient will come back to you. So all that matters is how you treat a patient. An unhappy patient has to be a VIP or a god entering the chamber. And this is the only chance. God has come once. How you are going to please him, that is up to you. If you please him, he will spread a positive word to 100 patients. But if you don't please your God, then done. Then nobody is going to help you. Got it?
Can I add something? One clarification with what Pavitra said. Pavitra said is, see, when you have a older man as a senior, very senior person sitting in the same clinic with a junior lady, I have also heard this. After you tell everything, no, they'll say, "Ayya pakanam, peri ayya pakanam."
Yeah.
So, so that is a tendency which we seem to hear when there are very senior, means 30 years plus senior people also there, and they also know, patients also know that they're there. Sir pakanam. So that may be there. That is what she is telling.
The 30-year-old females, they don't take seriously, sir. We don't look that old enough with wisdom and maturity that things we are saying. This is our colleague who is a male of the same age would be saying the same exact thing, sir. But their value is much more than ours. They just don't take us seriously in most of the times.
We have
No,
no choice.
let me
We have to
add
take
a
it
word here,
seriously.
please.
Can I add one small thing here?
Yes, sir. Dr. Rajan sir, then Dr. Dhami, please. Yes.
Yeah, because this unhappy patients and patients who are cranky, I fully agree with you. Pre-operatively, you need to find out these troubleshooters and find out this category of patients. And post-operatively also, what we do, we have a small code. It's a small red code which is on the discharge summary as well as it comes on the pops up on the EMR for us. Okay, and I inform right from the security to the reception to the optometrist. Okay, as soon as the patient comes, don't even talk to them. Straight away, bring the patient to my chamber. Yeah, straight away, bring it. Not even the patient.
So in our fellowship place also, we had our counselors used to write TT on top. So when the file came to us, we already knew that we have to deal with them in a certain
Absolutely. These are all troubleshooter patients. Straight away, you bring them here, because if you allow them to wait in the OP, that guy will create trouble, create a big furor there and spoil the other patients also. So this is the biggest problem we have. So you bring the patient inside, give them VIP treatment. You don't even check the vision for them. Just see them, say hello to them, say everything is fine, you'll be all right, and make sure that he goes out of the hospital. Sometimes I even escort them out. Take him to the road and leave them come. Even if you don't collect the fees, it doesn't matter. I don't mind foregoing the fees for that patient. But this patient should not be there in a hospital for more than 2 or 3 minutes, in my opinion. Okay, he has to come and finish off. If he has got any OCT be done, immediately the OCT will be done. You'll be there, right there, and finish off, and so that the patient goes off immediately. Not waiting in the reception. If he waits in the reception, this patient is going to create a lot of galata there and create problem for other patients as well. You'll demoralize the other patients. And one happy patient is going to bring 10 happy patients. But one unhappy patient, you lose 100 patients. Please understand. This is the logic, and this is the what you call the equation.
Right. Dr. Dhami sir, you were making a point.
Mohan, you really made a point that these patients should be marked on the EMR and entry free, entry fast track. But before that, we do confirm that actually there's nothing wrong with this person. Surgically, ocular surface, in the retina, or any unblock, any associated pathology, or really he's that is very important. Then fire him out as fast as you can.
Yeah, absolutely, sir. That is the main thing, because if he's got a problem, obviously you have to treat the problem. These are guys who will not have any problem. They will have 6/5 and 6 vision. They will have everything normal, but still create some problem. So I'm not able to see this side, negative dysphotosia. I'm not able to, because my first eye took 5 minutes, second eye took 15 minutes. So something is wrong with my second eye. They'll have that mentality. These are all what is called type A personalities. Very difficult to deal with them.
It is better to identify this type A pre-operatively and under-promise these people. These type A personalities should be identified pre-operatively by yourself and also by your counselor. Mark it on your case sheet, under-promise them so that post-operatively they don't create more nuisance. Second thing, what Dr. Mohan also said, I had this problem when I shifted to Indore. Usually, the trend in Indore was you operate one eye, after 1 month only the other eye should be operated. So what I started was, when I came, I never knew about this trend, and I operated in a gap of 2 weeks. So every time the patient used to complain, sir, first eye was good, second eye you operated soon, that's why I'm not able to see clearly. In spite of having all the good 6 weeks, everything is good. But that psychology is there. The second eye was operated too early, all the other doctors operated after 1 month, but you operated after 2 weeks and I'm having problem. So you have to understand the trend and try to counsel them. This also is a very important issue. That what is the area of practice in your area where you're practicing. Suppose a person is operating in like bilateral surgeries, simultaneous bilateral surgeries, or the other eye surgery in a gap of 1 week. So there is a double-edged sword. You operate one eye, both eyes cataract, you tell the patient, and you don't operate the other eye after a week. You operate late. He might tell, Sir, my neighbor had got operated both eyes in the gap of 1 week.
Yes.
He is able to see clearly, but I am not able to see clearly because the second eye was operated late.
Right,
And
right.
you have to
I
take
think-
care of this. What is there
Yeah.
in your area?
The great pearl here is identify these patients pre-operatively. Mark them out pre-operatively only. That's I think one tip that us juniors can take. We need to identify such patients pre-operatively itself.